Throughout history and in every culture, there have been people who claimed that they could see into the future. They were known by multiple names: seer, soothsayer, fortune teller, even prophet. These days, they might be known as a futurist or a futurologist, and they're just as likely to be found in a think tank in Washington, D.C., or on the campus at Google, as they are to be found in a side tent at a traveling carnival. What these people have had in common over the years has been that they were all unerringly wrong. So why have we chosen to interview a futurologist for this opening episode of the series Unmasked Interviews? Well, Sohail Inayatullah is not your run-of-the-mill futurologist. He is the UNESCO Chair of Futures Studies at the UN and a professor at Tamkang University in Taiwan. And as such, he brings a much more academic approach to the process of looking ahead. His technique of causal layered analysis is a way of looking at where we are now, how we tell ourselves stories, and what we focus on. And he uses analysis of that to help us choose our own future, to create our own future through an activity of structured change. I've given a brief and very imperfect introduction to the idea of futures and causal layered analysis, which is your expertise, but can you perhaps put it in your own terms for the layman's understanding?
Well, if you look at futures historically, there was a period people were trying to predict the future. Let's reduce risk, mitigate risk. Let's figure out what's going to happen next. So in the 60s, you had all this trying to work, let's predict. Then by 70s, 80s, people figured out you can't predict because the act of prediction gets entangled in what the world looks like. It's almost self-fulfilling prophecies. So they moved to scenarios, not one prediction, but 2, 3, 4 futures alternatives. Then from there, the last 20 years, people saying, well, let's go to depth. What do you do once you have the scenario? How do you get decision makers, policy makers, citizens to actually change how they not just see the future, but how they act on the future?
So the idea here is not to simply look into a crystal ball and say, this is going to happen with a certain amount of certainty, but to give people the tools to prepare for a range of potential outcomes.
Yeah, and the ability to make sense and act on it. One international organization I was working with, they wanted to set up a horizon scanning network. So let's see how the world is changing, so we're one step ahead of everyone. We can act quicker, more wisely. Then I said, okay, tell me what your narrative is. And their underlying metaphor is that, in fact, we're a tiger without teeth, a toothless tiger. So I said, so you create a horizon scanning network, you get information, but you can't act on it. How will your executives feel? They'll feel horrible. Information that it can't be acted on, they'll lose hope. So I said, first we need to change our core narrative. So I said, what's a better story? Is it the better story is a guard dog. Our guard dog is trusted, loved by the community, has an early warning system. So in this sense, now you've changed your narrative. Now you have a horizon scanning network, looking at emerging issues, what's unknown, what's down the road. You get the information, you can act on it in a ways that builds community trust.
Explain very quickly, if you would, what is the value of the narrative and the metaphor in this setup? It's an interesting approach because most governments, I would imagine, and certainly most corporations would probably say, give me hard data, give me facts, give me numbers, give me analysis that makes sense in an academic sense. The idea that we should begin to picture and storify our approach to this thing is a really interesting approach.
I remember in 2008, Financial Times had a great article, a global crisis in search of a narrative. Is it a mortgage crisis? Is it a banking crisis? Is it a deeper financial crisis? Is it a crisis in world capitalism? So there's see the data, but the data doesn't make sense unless you have a story. Everyone has a story that they use to make sense of data. Once you decide the data, then you act. In this case, they decided it's really a financial crisis. Let's save Wall Street and forget about Main Street. So the story tells us what we need to do. The story informs how we see the world, makes sense of the world, and I would actually say how we create the world.
All right.
So we're in a similar situation with COVID-19 now.
Well, let's tell some stories and make sense of this COVID-19 situation through that lens then. And you've done this exercise already. You did you did it fairly in depth for a couple of clients, I believe, and I've had a look at it. And you've created 4 scenarios, 4 potential outcomes that you think we might lead to, and put them, as you say, in terms of a narrative and a metaphor. 2 of them are distinctly dystopian. A couple of them are slightly more hopeful. Can we just quickly run through all 4 of them and give us a sense of the scope here?
So scenario 1 is the future feels like a zombie apocalypse. It's uncontrollable. We don't know if the virus will mutate. We don't know who there is to blame. So almost the narrative is danger, danger, let's play the blame game.
It's a great name, and the thing that I've discovered in looking into this is that actually the scenario you're positing is not actually so ridiculous. The Centers for Disease Control in the United States actually has a blog called the Zombie Apocalypse blog, talking about the very possibility of exactly this kind of scenario. So how could we arrive at this stage when we already had this scenario in mind?
So what they did, of course, they figured out if we don't act wisely, if we don't prepare alternatives, if we don't immerse ourselves in these emerging futures, it will feel like something horrible. So you want to develop anticipatory systems so when things go wrong, you can act very quickly. The nations that acted quickly, Taiwan, for example, they've done much better. They were prepared from SARS. So zombie apocalypse you put out there as a future, not to get people worried, but to say, if we do nothing, here's what could happen. Let's do something.
And the reason I asked the question, if the CDC had this scenario in mind already and yet failed to act upon it, how can futures and scenario planning actually be of use, actually make people take the action that's necessary to prevent a scenario like that from occurring?
So if you look at the 2 countries, the ones who had the scenario and acted and the ones who had the scenarios but didn't act, what's the difference? One, leadership short-term oriented, playing the blame game. Second, leadership that's long-term oriented, to say the health of our country is first. So this is where the scenarios help us, but you still have to buy in from your top leadership. It can't be just a few scientists, a few professors being prophetic. It's interesting, but ultimately we have to change the collective narrative of how we see reality.
I want to talk about that collective idea a little later on, but let's get through the other scenarios. Let's skip to the second, more dystopian of your scenarios, and that is the Great Despair. How does that differ from the zombie apocalypse?
Well, great despair is we start to act, we do social distancing or physical distancing, we do this hammer and dance, we close airports with the intention and the hope things will be okay. In year 2, year 3, still global tourism hasn't recovered. There's a long-term recession. The virus mutates. So this is where it's an emerging issue that has first, second order impacts that actually wreck the world economy, lead to fractured nations, actually lead to a whole range of bad consequences. So we think we've solved it, that it's merely a scientific technical issue, but we find out it's much deeper than that. And after basically the great malaise is after COVID-19, you have climate change. So it's one crisis after another. So that leads to the great malaise.
And how, in that context, if that becomes the favored scenario, how would you then advise governments or any individual or collective group to react to that scenario? I mean, what would the next step be to say, okay, this is what we think is a likely scenario, therefore this is how we must proceed?
Well, you want to be able to simultaneously be working on the virus, on the financial system, and climate change. And you want to take small steps forward. We were having one meeting with a whole range of Interpol executives, and we were saying, well, let's start to think of this in terms of zones. Zone is a green zone. Here's safe area. There's a red zone. Here's danger zones. Orange zone, some warning. So we set up openings and closures. So you start to think through if the next 6-7 years will be a malaise, how do we get prepared for that? And externally, you figure out, okay, this is now a mental health issue as well. It's not just a physical disease, a virus. People will be impacted. So now you're trying to think through, given that there's going to be mental health issues, abuse at home, let's get ready for that.
Okay, let's move on to the 2 slightly less worrying of your scenarios. Let's leave the great medical advances for last, because I think that's the most interesting of them. Your third and slightly more optimistic one is?
Well, that's the great pause, that this is just an exogenous event. It's external. It's a year to pause, slow down. We get clean air, pollution drops. People spend more time with their families. They go inwards, maybe meditate more, do some yoga, breathe in, breathe out. And the pause leads next year to you slow down to speed up. So that's why for many, the markets haven't totally crashed because everyone's expecting this will work itself out. This is a short-term event. And think afterwards, what are the things that I enjoy in this year or next year, and what of those things do I keep?
Certainly, I've seen a lot of governments talking that way and a lot of individuals talking that way. There's more, sometimes you wonder whether there's more hope there than actual basis in reality. But let's get on to the fourth scenario. So you've called this one the global health awakening. Why specifically focusing on the health aspect here? Obviously it's COVID, but...
Yeah, if you see it in terms of narrative, is it just a disease, right? If it's just a disease, you find the vaccine and the cure, done. Is it just a financial crisis, then how do you increase liquidity through the markets? How do you support those being unemployed? But then if you say, well, actually, this is a global health crisis, then you see it differently. This is the great narrative. Here's our chance to awaken. So then you see this, the story that's being told, this is a chance to actually have a renaissance. It's the most idealistic. So we call it the 5P health model. So you have prevention. How do we make sure this doesn't happen again? You have personalization, which you target health policies for the person. You have partnership, everyone working together. You have participatory, everyone has to be involved in solving these problems. So you start to see this quite dramatic shift in how we see the future of health. It's idealistic. It's saying we don't go back to business as usual.
And you're talking here about really quite root and branch change of the entire way we deal not only with health, but actually in how we live.
Yeah, I mean, so the likely scenario is, of course, pause back to the norm. So what we're arguing here instead, well, here's some moments. There's some leverage points where, in fact, we can change and we should change. That means you have to have a collective narrative, a great health awakening. You have to figure out where in the system can you make the change. So this, if you switch the narrative, it's a bit harder, but you think, okay, this is the opportunity to do something else. If you go back to SARS, when SARS happened, Alibaba was just starting. And the minute it happened, they said, oh my God, our entire business model is about to crash. They quickly went online. And so now I'm trying to think through, okay, which of the other companies where their core business model is being challenged and they figure out, no, it's not business as usual, it's business transformed. So for me at a global governance level, what does WHO need to do differently? It's like with weapons inspectors, WHO needs to have teeth. It can't be just intellectuals getting policy advice. This is too scary. I mean, COVID-19 is scary, but imagine COVID-19 cubed 5 years from now.
You did this particular analysis. You came up with these four scenarios a few weeks ago, right? And you did it in a specific context. Have you had thoughts since then? Have you seen perhaps one or other of those scenarios becoming more likely or more apparent? How have you updated your thinking in the weeks that have gone past?
But I think the zombie apocalypse worked in the sense this is the worst case. We will not go that route. And then now you see this debate slow down, and next year we speed up. And then some people are going to say, wait a second, do I really want to speed up?
When you say the zombie apocalypse worked, you mean people saw that scenario, recognized how dangerous it would be, and are taking steps to avoid that happening. Is that what you mean?
Yeah, the Australian government modeling, what I saw, they said if we do nothing, is 180,000 deaths. Their deaths are, I think, 100. So they figured out, here's if we do nothing, here's if we act. And they made the decision and they acted. Now today the Prime Minister, he was asked, well, why don't we just stop this? He said, death is not open for negotiation. I will not let the country go there. So this is, again, he's figured it out.
Similar scenario happened in the UK, didn't it? The government there was entirely prepared to allow this thing to play itself out without really much intervention until that Imperial College report, and suddenly that zombie apocalypse reality was very apparent to them, and they switched course, didn't they?
Yeah, so in that sense, exactly how you're saying it, these scenarios aren't flatland. They're complex adaptive systems. You put the scenarios out there, they react to the world, then you have to change again. Now, to get people interested, they have to have a story that makes sense of it. If your story is blame game, Doesn't matter what information you say, the only thing the decision maker hears is, oh, how do I blame someone else?
So the zombie apocalypse scenario acted well as a sort of a preventive measure, but are we seeing that helping push us towards one of the other scenarios? Because the idea of an entire global health rethink is an attractive one, and certainly one that probably makes a whole lot of sense, but that requires a different stage, a different level of activity and decision making, doesn't it? Are you seeing anybody taking that on board?
You have nation states meeting saying this is now a global issue. Now, of course, because it's urgent and important, they'll make agreements. And we get excited by them. 3 years down the road, will they actually still agree to them? So this has been the climate change dilemma, right? At the same time, young people are saying, wait a second, we've been pushing the climate change discourse for a decade, you have not acted. All it took is your generation to be threatened and you acted. So then there's a sense, wait a second, if this is possible, if it's possible once on one issue, why isn't it possible on other more major issues? So it seems like there's nothing we can do. Now, so in a sense, well, actually, there's many things we can do.
Who do you think this particular set of scenarios is most applicable to? And I'm thinking now, going back to what we talked about earlier on about collective action is required. Collective action on a global scale is a near impossibility, isn't it? I mean, you can't get agreement and consensus on something like this amongst all 196 or however many different nation states are part of the UN. And obviously we've seen it play out differently in the different countries too. So the same action wouldn't necessarily be applicable in all those different cases. So how do we generate collective action in a context like this when the experience is so fragmented?
One is the global level, right? You have international agreements. Then there's a personal level, what's my zone of control? How will I act in a safer and a different way? Then you also have movements saying, here's a future we want. Remember, the world we live in was once an imagined future. So the world we wish to be in, it also becomes an imagined future. So this becomes a collective decision making. Which future do we want? And that is being debated. Clearly, no one is saying long live wet markets. Long live a trade in dangerous wildlife animals. No one is saying that. Animal health experts have been warning us for 10, 20 years, though that trade must stop. Now we're saying, well, you lose some money in the trade, but here's how much you gain. So this is where the shock in the long run creates collective goods.
We need to have the strength and the imagination to imagine our future as we want it to be and bring that about.
Yeah, I think that's part of it. So future starts out, we predict, we move to scenarios, then we go deeper with stories, and then finally, what story do we want to tell about ourselves and where do we wish to go? That's the utility of foresight.
Let's hope that we all imagine the more utopian future and make that happen. Sohail, thanks very much indeed.
Yeah, I would prefer, let's go with utopia, and if it doesn't happen, we step back, but at least we're moving in the right direction.
Sohail, great talking to you. Thanks a lot for joining me.
My pleasure. Thanks so much.